Hello, everyone, and welcome to our Ventura TV. I'm Sandra Siepak. On today's show, I'd like to welcome Dr. Sarah Bonza. She is a board-certified family physician specializing in women's hormonal health, and we'd like to welcome her to the show. Thank you so much, Dr. Bonza.
Thank you, Sandra. Thank you for having me today.
Great. Today, we're going to talk about women's health, and especially women's health after 55 plus. Some of the changes and understanding some of the menopausal changes and symptoms that women go through and how to manage care. So I'd like to start with some of those changes after 55 plus and how to recognize those changes for your own well-being.
So the thing about this question is it varies for everybody. Every woman is different.
Right.
But commonly in women, as we reach the age of over 50, say, hot flashes become a little more prominent. Now, these symptoms can start as early as your 40s, and some women experience hot flashes in their late 30s. And that is more prevalent in women who smoke, actually. So we
Okay.
see these symptoms starting earlier for women when they use tobacco, smoking
Okay.
tobacco. So hot flashes are the big ones. And the other things women may notice is that their waistline is expanding a little bit and there's nothing that they're really changing, but their pants are not fitting. So weight gain is another thing that women will see as they start to transition with these hormonal changes.
And it has nothing to do with anything they've done, such as diet or anything. It's just the hormonal changes that are bringing this about.
That's right. And that's part of what makes this so frustrating. There are many women who are exercising and doing
Yes.
everything right. They're going to the doctor and their cholesterol is increasing. And
Okay.
they feel like, what am I doing? What else can I do? And that's part of the natural hormone changes. Estrogen changes the way that our body metabolizes and uses cholesterol,
Okay.
particularly LDL cholesterol.
So
So
do you think it's important for women to recognize those changes and then decide with their doctor what should be done for their well-being?
absolutely, absolutely. Your doctor can be your first partner in your health.
Okay.
And I think there's so much information out there on the internet and social media that if women start really looking for these answers to what's happening with their body as they're aging and changing, they may find a lot of pearls of wisdom to help themselves.
Okay.
So
Do you recommend therapy, estrogen therapy?
I do. I do. For women who qualify, absolutely, I recommend that they use hormone therapy, both estrogen and progesterone.
Okay.
Everybody's unique. It's an individual
Yes.
recommendation. But I do know that years ago in 2001, the World Health or the Women's Health Initiative, sorry,
Sure.
it really did a great disservice for women in terms of being able to access hormone therapy. And now we're learning that this is a very beneficial therapy for women.
Okay. Um, as you mentioned, cholesterol may play a big part in your own health. So, how would you address that with women? They may be eating right, they may be exercising right, but the cholesterol levels are climbing. And how do you deal with that?
The best way to deal with these changes that we see are multifactorial approaches.
Okay.
Lifestyle approaches always first. Even
Yes.
stress levels can impact your metabolic health.
Oh, okay.
So, getting plenty of sleep and that kind of thing will help women. When it comes to going to the doctor and saying, my cholesterol is climbing, I'm doing everything I can,
Right.
most likely the doctor will talk about prescribing anti-cholesterol medications, like
Hmm.
statins are the most common, and there's a couple others.
Right. Okay. So again, you can address this with your own doctor, and diet and exercise may help. But if it doesn't, there might be other alternatives for you to think about and consider.
Absolutely. Yep.
Okay.
Using those healthy habits will really help you set yourself up to for longevity and
Right.
just having, more strength as you age.
Right. And I think, some women may feel tired, they may feel irritable, they may feel so many different changes, and they may not know how to address that. So I think it's good to, get a better idea from your doctor as to what you should address first.
You're very right. But the one thing that women need to remember is that physicians were not trained on
Okay.
how to manage these symptoms, especially you mentioned depression.
Right.
So for women who are noticing mood swings, they're not quite
Oh,
feeling like themselves, they're
okay.
having fatigue that can be related to decreases in your estrogen,
Okay.
and hormone therapy can be helpful in those instances. So if women are not quite comfortable with the advice they're getting from their doctor, it is okay to
Okay.
continually seek that opinion.
Well, that's good to know. That's good to know. What about cardiovascular health? I know that that may be something that women would want to know more about, for just their benefit of long-term care, and so that they're healthy in their life. And how does that play a part in overall health?
After the age of 55,
Right.
cardiovascular disease risk really increases for women,
Okay.
and many are caught by surprise. Has a protective impact on your blood vessels everywhere in your body, including your heart. So it is very important to be aware of that and to not dismiss some of those symptoms that may creep up, such as even just fatigue, shortness of breath, decreased exercise ability can all be signs that
Yeah.
maybe a stress test would be helpful.
Okay. So we're running out of time, but in closing, I just wanted to get an idea from you what else you would like to suggest to women out there for good overall care, and what you would give women advice on.
I think the overarching thought is self-care,
Okay.
listening to your body, being aware of its changes, taking care of yourself, not pushing too hard, but really starting to think in terms of what can I do today to help myself be a little bit healthier, whether it's healthy eating, whether it's a little bit of exercise.
Good.
Those kinds of habits go a long way.
Right. Take good care of yourself.
Exactly. Yes.
Very good. Um, I would like to have you give everyone your website for those who would like more information on all that you do.
Sure. My website is www.bonzahealth.com. I don't know if that's spelled on the screen. Bonza is the
Okay.
last name. And yes, I have lots of blogs up, and I cover information about cardiovascular risks, health risks as we're aging and getting into our 50s, and when are times to think about hormone therapy. And
Good.
I'm also reachable on the site as well. So
Wonderful. It's such good information for all that really, really could use it. And we thank you so much, Dr. Sarah Bonza, for joining us today on our Ventura TV. We look forward to seeing you again. And thank all of you for joining us today on our Ventura TV. I'm Sandra Siepak. Look forward to seeing you next time. Bye, everyone.